Thank you. Good morning, good afternoon, good evening, everybody. Welcome to this timely webinar on health diplomacy role on climate, migration, and infectious disease nexus. And before we begin, I would like to share some housekeeping rules. Please keep your microphone on mute, and we encourage you to use the chat function and the Q&A to engage with our speakers during the Q&A session. This session is being recorded, and you will be able to have live transcript in your desired language. So kindly turn on the settings and find in the chat the instructions to do so. We are sharing at this moment the reference to do the setting. So now that we have the housekeeping out of the way, in the context of this mounting concern of impacts on climate change, migrations, and disease, this webinar brings together experts to explore how health diplomacy can effectively address the interlinking and increasing impact in vulnerable population globally, and especially in sensitive humanitarian settings. We understand that health diplomacy is vital to facilitate the dialogue and the cooperation among diverse actors, including governments, international organizations, civil society, and to ensure that health services remain accessible and despite political or security challenges we're facing right now during geopolitical complexity. So the complex of these three areas obviously require and demands an integrated policy response that go beyond borders. And that's the reason why health diplomacy serve as a key tool, a practical tool to coordinate at the multi-sectoral level to promote these shared solutions. Migration, we have seen in the last year, migration driven by environmental factors are exacerbating not only conflict, but disease transmission. And what we will see in this panel is how those diplomatic engagements comes into place, especially when we have cross-border health issues that are in detriment of this displaced population. But for that, I think I will need to leave that to the experts. And before that, I would now like to introduce our moderator, Valerie Dose from the Health Diplomacy Alliance, who's specializing in global climate health policy at Princeton. She will be moderating our discussion, and today we'll present our speakers. Valerie, the floor is yours.
Hello, and thank you for the introduction, and welcome to our speakers and participants. During the session, you may enter questions in the Q&A or the chat throughout the session, and they will be addressed after the speakers have concluded. So now, to better understand the role of health diplomacy in the intersection of climate, migration, and infectious disease, I call upon our first speaker, Yulia Duka. Yulia Duka is a program officer in the Climate Action Division at the International Organization for Migration, or IOM. She has extensive experience working at the intersection of migration, environment, and climate change. Prior to joining IOM, she gained valuable experience in multilateral diplomacy through various roles and traineeships in diplomatic missions, including the permanent missions of Spain and Romania to the United Nations in Geneva. She holds a master's degree in international relations and diplomacy and a bachelor's degree in law. She will be kicking off and setting the discussion, the context of our discussion, by sharing her understanding of the climate migration issue and the health impacts that climate migrants face, as well as the work that IOM is doing on this topic currently. Yulia Duka, we welcome you, and the floor is yours for the next 10 minutes.
Thank you very much, Valerie, and thank you to Catherine as well for convening this event and for bringing all of us together here, and of course to the whole Health Diplomacy Alliance team for putting this together. So no need to introduce myself. Thank you, Valerie, for briefly presenting myself and the work that I've been doing and I'm doing currently. It is with a really great pleasure to join all of you for this important dialogue today and to really try to dive more into one of the defining challenges of our time, which is the intersection of climate change, migration, and health. These topics are not, and I want to start with this and put the spotlight on the fact that these three, climate, migration, and health, are not isolated issues, but rather they are deeply interconnected, and each of them influencing each other's and amplifying, of course, one another. That's why we need to think of them comprehensively and together, and try to respond into a coherent, inclusive, and cross-sectoral approach. From the IOM side, from the International Organization for Migration, I want to say that we view climate change not only as an environmental challenge and emergency, but as a force multiplier. As Catherine also was mentioning, climate change is accelerating displacement and deepening health vulnerabilities around the world. So maybe I will try to give you a bit of an overview of what this means for us in terms of the data that we have available. And currently, especially while we are talking and we are seeing in the news the impacts of floods and others, including in developed countries, of how people are being displaced and their health or lives are being lost, unfortunately. I want to emphasize the fact that we are witnessing these days a displacement driven by climate impacts at an unprecedented scale. And according to the Internal Displacement Monitoring Center and its most recent report, we saw that in 2024 alone, more than 45 million people have been displaced because of disasters. And this number of more than 45 million people, it's nearly the double the average annual displacement over the last decade. And it was a record number of displaced people because of disaster. And this is not just statistic. This is like really, we are talking about people. We are talking about families that have been uprooted by drought in the Horn of Africa. We are talking about communities that have been submerged by floods in countries like Pakistan. We are talking about lives that have been turned upside down by wildfires in developed countries like Americas, or we've seen communities being displaced because of cyclones in regions like Pacific. So really, these numbers that we are like keep referring to as policymakers is not just statistic. It's really real lives and real people, women, children, youth, and so on. They see their lives being disrupted because of disasters and the impacts of their movement. So displacement today, what I also want to flag to all of you, that displacement today is most often happening internally and is prolonged, and it's occurring most often in really fragile contexts where health systems are already under severe threat. In this type of environments, the risk of infection diseases outbreaks are really amplified, and the access to essential health services is very often seen as being disrupted. So from IOM side, we see firsthand how environmental impacts disrupt traditional migration routes. We see how people are being pushed into overcrowded informal settlements. We see how forced interactions with new ecological zones they need to face, and all of this increases disease transmissions risk. So these kind of scenarios, to think about displaced population, that they are the ones that very often they have limited or no access to primary healthcare in this kind of situation. They have disrupted vaccinations, disrupted maternal and child care. They have inadequate nutrition, and very often poor water and sanitation. All this happens in addition to the psychological trauma that these people experience because they are displaced due to disasters. So this is one of the reasons why at IOM we recognize that migration, health, and climate change are deeply interconnected and really must be addressed through a coherent, inclusive, and multi-sectoral approach, as I was mentioning at the beginning. But maybe to give an example to all of you, to get a bit of a more sense what it meant when it went through several crises overlap. I refer back to the COVID-19 pandemic and really shed a light on the devastating effects that disparities and inequalities in access to healthcare can have for all of us, and really reveals the direct links between health security and human mobility. So during the pandemic, these challenges have been worsened. So giving an example, a clear example, in one of the places like Cox's Bazar in Bangladesh, as we know is one of the world's largest refugee camps, we've witnessed seasonal floods that make things even harder during the COVID-19 pandemic. So the flooding worsened the already cramped living conditions for those refugee people, make it nearly impossible for people to follow social distancing rules or stay in isolations, as we were all advised to do in order to protect ourselves from the virus. So it was really impossible for refugee people living in that refugee camps, to really reach health services and have access to health services and respect the rules imposed by the community or the health community. So this example really show clearly how two concurrent crises like the climate change and the health emergency can happen at the same time and really hit the most vulnerable people the hardest. This type of example that I'm flagging to you right now highlights the importance of really identifying and supporting those most affected by impacts of climate change, which is often they are the least responsible for the climate crisis, but they are the ones suffering the harsh effects and the consequences of it. So when it comes to the health diplomacy, in my opinion, it plays a key role in promoting more equitable outcomes by ensuring that the responses are inclusive and responsive to those needs. This includes from our side to strengthen systems and policies so that all people, including migrants and displaced people, can access essential health services regardless of their status, which is one of the things that we've always witnessed during the COVID-19 pandemic. Health diplomacy plays a critical role in this kind of situation, not only in coordinating multilateral responses, but in really trying to elevate the voices of displaced people and migrants and other communities within the climate and health negotiations. In this case, we need to think about diplomacy, not just the health diplomacy, not just as a reaction to the crisis that we are living, but really how we can better prepare and prevent this type of crisis. And we can do this as a community by investing in resilient health systems, in supporting sustainable migration governance, or by fostering regional cooperation. And from the International Organization for Migration, I want to emphasize that this is one of our commitments. At IOM, we assist and protect people on the move in the context of climate change, but we also support people to stay in their places of origin. And we work together really robust evidence when it comes to displaced people and people on the move in the context of climate change, but also related to the health impacts of climate-related mobility. So in order to make sure that all the responses are targeted and sustainable for these people. So maybe I'll try very briefly to explain and to give you a bit of an overview or a bit of a sense of what it means for IOM, these type of actions and how do we approach them. And I want to emphasize that IOM works across regions and try to support governments to really rehabilitate clinics, expand mobile health outreach, and build capacity among health and environment ministries to really reflect human mobility realities in adaptations and public health planning. Also, from IOM side, we approach these regional frameworks like the Kampala Declaration on Migration, Environment and Climate Change, or the Pacific Regional Framework on Climate Mobility. From IOM side, at IOM, we try to promote the inclusive of human mobility in national climate and health strategies, including measures for plan relocation, labor migration, and health access without any type of discrimination. And maybe a last point to explain will be the work that we do at the global level. From IOM side, we engage in the United Nations Framework Convention of Climate Change, the Conference of Parties, what we all know as the community as the COP. And we call during the COP conversation and negotiation, we call for the integration of climate mobility into climate agenda, linking it directly to health, to resilience, and to human rights. So maybe before I end, because I know we have a bit only 1 hour, unfortunately, to dive more into this topic. But before I end, I want to emphasize that maybe one of the questions that we should ask ourselves today is not just like if climate mobility will define our area and the times that we are living, but rather how we choose to respond to this. Because as I mentioned, climate mobility is a reality across all regions around the world. And in order to achieve health equity, to achieve health equity, displacement must really be addressed as both a consequence and a cause of health disparities. So maybe I hope that we can take today's dialogue not just to reflect on a few things, but really think together as a community how we can mobilize ourselves, how we can mobilize resources and actions to respond to the needs of those most vulnerable, and then the first line to climate change. And maybe for all of us to try to foster the partnership across diplomacy, across health, climate, and migration sector, to invest in better in resilient system, and really make sure that people on the move are not left behind, but really protected, empowered, and included in every decision that we make, and they have a seat at the table. So I'll try to stop here, but I'm happy to respond to more questions related to the work that IOM is doing, but also on the intersections of migration, environment, climate change, and health. Thank you, Valerie. Back to you.
Thank you so much for your excellent remarks to set the stage for the conversation by describing the cross-sectoral approach necessary to address the force multiplier issues. As you emphasized, those least responsible for the climate crisis are unfortunately the ones suffering the most from it. And your insight on the critical role health diplomacy plays in elevating the role of displaced people in terms of climate and health negotiations is integral to point out. And your points on health equity and health disparities are valuable and bring us to the next speaker on the panel, Dr. James Shepard. Dr. Shepard is a faculty physician in the section of infectious disease in the Department of Medicine at Yale University School of Medicine, where he teaches planetary change, biodiversity loss, and infectious diseases. During the COVID pandemic, he assisted the WHO in coordinating the response to COVID in the refugee camps in Cox's Bazar, Bangladesh. He will share with us his insights on the infectious disease aspects of climate change and human migration. Dr. Shepard, the floor is yours. Thank you.
Muted.
Oh, you're muted. Sorry.
Sorry about that. Good morning, everyone. I think I'm unmuted now, but confirm if you can't hear me. I was just saying it is me. I have a beard now, so if you're wondering who the gentleman is in the picture, it's me without a beard. And like Julia, I take my general recent health diplomacy experience back to the COVID pandemic and work in southern Bangladesh in the large refugee camp in Cox's Bazar to use as an example of something that I want to emphasize in my 10 minutes this morning, which is a host factor. In all infectious diseases, there are hosts, and that's usually us. There are agents, which are the infections, and then there's the environmental factor that brings both host and agent together. And I'm going to focus on the host, mainly because that's really where health diplomacy also tends to focus as a first stop. So going back to the beginning of the pandemic, I was ex-WHO. I'm a TB and HIV specialist and had worked for the WHO before in tuberculosis in South Asia. And so I got a request to help right at the beginning of the pandemic through the Global Outbreak and Response Network, which was tasked with dealing with the anticipated impact of this highly infectious virus, COVID, in the huge 1 million population camp in Cox's Bazar in southeastern Bangladesh, where health diplomacy required us to call the inhabitants forcibly displaced Myanmar natives. And we formed a group which was highly interactive and broad with the usual partners that you would expect, including International Organization of Migration, the UNHCR, MSF, Save the Children, Red Cross, Red Crescent, but very importantly, the government of Bangladesh, which, as we all know, it's critical to involve the host government in any international efforts and diplomatic engagements within their borders. And although the WHO focus initially was concerned with the large camp and the crowded conditions and the poor services, and coordinating the various partners to provide pandemic preparedness and healthcare services, which were anticipated to be stretched extremely severely. The host government, the government of Bangladesh, very reasonably said, well, if you're going to bring in this expertise and this support for FDMN refugees from Myanmar, you have to provide the same level of services and support for our host population. And indeed, in that region of southern Bangladesh, there were approximately 4 million Bangladeshis living. So 80% of that community were local and could reasonably request us to provide the same level of services for them. So we crafted a method of supporting both host infrastructure, which was primarily the district hospital in the town of Cox's Bazar called Sadar Hospital, and link it to the network of healthcare facilities that the providers had set up in the various different camps within the larger refugee camp of 1 million refugees. And I think it was quite successful. And we supported the clinical management of COVID, regardless of whether the person in the intensive care unit or the emergency department or the urgent care facility that required oxygen or steroids or antivirals, didn't matter whether they were from the camp or from the local community. They all required the same level of care and assistance from the WHO. And I use the example to highlight what Julia said as well, and it's a very important point, I think, which is that visibly internationally, international refugees, migrants, forced displacement gathers the news and becomes very obvious when you switch on whatever your news feed or channel is, wherever you are in the world. But the majority of humans are migrating internally. The movement primarily is one of urbanization. And I want to emphasize that as one of the primary factors that is changing the complexion of infectious diseases globally. So the majority of people in Bangladesh, in Africa, in Asia, in Latin America, and indeed in the wealthy parts of the world, in North America, is movement from the rural countryside areas into the suburban and city areas. And in the global south, the less well-off parts of the world, that tends to focus human migration, as Julia mentioned, into vast unincorporated communities forming around the center of pre-existing cities that are growing faster than any other human population. And just to give you a tiny piece of data from the COVID pandemic again, on the very basic level, this human movement from the countryside to unincorporated settlements on the edge and in land within large cities changes the complexion of infectious diseases. One particular settlement that we TB physicians know very well is in Mumbai in India, called Dharavi, which is an incredibly dense downtown, what the Mumbai authorities call a slum. It's always been a very fertile place for infectious diseases to spread because of the human population density and the lack of any facilities or sanitary public health. And in that setting, with COVID, in March 2020, so just as the virus was beginning to spread globally, the seropositivity, that's the number of people with antibodies to COVID in Dharavi, was around zero. Very, very few tests came back positive. This is the city of Mumbai health authorities doing blood testing. By June of 2020, so just 3 months later, almost 2/3 of the population of Dharavi was positive for exposure to COVID. So just at that very basic level of epidemiology, the accumulation of hosts, humans, in an environment incredibly conducive to transmission of infectious diseases, with almost no facilities and public health services provided, is a recipe for a global pandemic. And we would certainly expect to see the same again as this process of urbanization is accelerating worldwide. And the human global population may be declining with lower birth rates, but its density in urban settings is going up. And that is the most important thing to think about from an infectious disease point of view, as you think about diplomatic engagement. So I'm at 10 minutes. I better stop there. Thank you very much. Back to you, Valerie.
Great. Thank you so much for sharing your expertise in infectious disease and especially your work in refugee settlements. Your point about the changing complexes of infectious disease, as well as not only spread across the borders, but also, especially now, internally within countries with internally displaced peoples, is extremely relevant. And this brings us to our final speaker, Lawrence Wong. Mr. Lawrence Wong is a policy analyst with the Migration Policy Institute's international program, primarily working on climate and migration. His research areas also include development and migration, border management, and refugee protection. Mr. Wong, thank you for joining us.
Thanks so much, Valerie. Nice to be here, and thanks to the team. Like Valerie said, I'm a policy analyst at MPI. I'm based in DC and work across our offices in DC and Brussels. We are a nonpartisan research institute that supports governments and policymakers across the world. We do a combination of public policy research, so that includes some of our innovative data-driven work to track migration. We do a set of informal convenings for governments and partners across regions, and then we're called in privately to advise governments and to advise international institutions and other stakeholders on the designs of policies and programs across a range of migration-related issues, including climate-related migration, including the links between migration and global health. I wear a few hats at MPI, but two of which might be particularly relevant. I lead MPI's global initiative on climate mobility. In short, that initiative conducts original research to advise policymakers on how to manage displacement and migration related to climate and environmental shocks. But when I was brought into MPI, I actually came in during the COVID pandemic, leaving IWEM actually. And I came in to support a task force on COVID and mobility, which brought together a group of experts and governments to coordinate on two things. First, how do you restart cross-border movement in a time of border closures and pandemic-related conditions on movement? And second, how do you minimize the impacts of the pandemic on migrants and displaced people? So I am very much a climate and migration person, not a health person, but we've done a lot of work with WHO and with others on understanding migrant access to health. And I think most recently, we've been working with some partners to look at the massive cuts to foreign aid and assistance in this moment and trying to understand how that might especially impact work at the nexus of climate and migration, but actually in some cases, given the steepness of the cuts to global health, how those might interact as well. So our research on climate and migration, it focuses on two phases of climate-related migration, both of which have intersections with health. So first, we look at how climate change and weather events drive movement. And our research consistently shows that climate change is rarely the sole factor in why people move, and it's usually a threat multiplier of economic, social, political, or health-related drivers of mobility. We have good data on this in Central America. Also, our data shows that only 6% say they moved because of environmental factors. In Central Africa, it's around 5%. The trick is that often the environment and climate factors are hidden underneath other factors, especially loss of livelihoods and loss of homes. When we do see significant disaster-related displacement, like the Internal Displacement Monitoring Center data, around 46 million internal displacements in 2024, um, our research shows that it's often the intersection of these massive disasters with other underlying fragilities that lead to movement. So in 2022, after the massive floods in Pakistan, the disaster itself led to significant internal movement, but it really was the combination of the disaster plus the economic crisis that made this movement protracted and often international. And so we know that health comes in here. We know that climate change and health interact in terms of vulnerability in terms of access to infectious diseases and other health shocks. We know that access to health services can decline during disasters and other climate shocks. So really, we think about how climate and health interact in driving movement. And on the other hand, we look at how climate impacts migrants and displaced people, regardless of why they move. So we don't just look at the drivers of movement, but also the conditions that people face after they move. And the critical piece here is that migrants and refugees and displaced people are often excluded from climate action and response in programming. And we have very good examples of this. So others have spoken about Rohingya refugees in Bangladesh, where there's been a lot of investment in early warning systems for them, and also community-based and infrastructural responses to make them resilient to typhoons and cyclones. We know that in East Africa, refugee camps are disproportionately built where they are vulnerable to desertification, drought, and heat waves. And we know that migrants tend to move within countries and tend to go to cities and often move to informal urban settlements in small and large cities. And once they arrive, they're often hit by floods, by landslides, by other disasters because they are moving to parts of the city without climate resilient infrastructure and systems. So we're concerned not just about how climate forces people to move, but how climate events impact people on the move. So we look at this second factor globally, even in high-income global north countries. So we're currently looking at the environmental justice initiatives in the United States, which under the previous administration were a huge priority. A significant portion of activities went to environmental justice, to tackling legacy pollution, to tackling heat, to tackling climate stresses, and their impacts on historically marginalized communities. And we think there's a really important role for health actors to play in making sure that migrants are included as we tackle this intersection of environmental threats and climate change with the impacts on human health, especially for marginalized populations. So that's a little bit about how we understand and think about this sort of triple nexus. But I want to raise a few lessons from MPI's work on climate health and mobility, and especially lessons that I think are important when it comes to global diplomacy and global governance in this current moment, which we think of as characterized very much by retrenchment from multilateralism and coordination and cooperation. So first is the importance of integrated, holistic approaches. The problems of silos are very real when it comes to policy making, and we can't get rid of silos. I come from my own migration-related silo in this issue, but we know how important coordinated approaches are. So one example, during COVID, we saw firsthand how ministries of health had in many countries basically never talked to ministries managing migration or managing borders. So governments had to set up their first interministerial coordination mechanisms in the moment of that crisis. In my work on climate migration, we've seen this even within the same ministry or the same team, the same departments. So we have partnerships with some development agencies, helping them to design migration and climate programming. And we're brought in by the migration teams to help do the program design. And the first step we often have to do is have a conversation with the climate team to bring them into that process, to make them bought in, and to bring in their expertise in a domain where many of us from the migration side of this field don't necessarily work. So it's important for the first step to be about breaking down those silos and thinking about how we collaborate across fields. A second is to think carefully about xenophobia, about scapegoating, about public narrative. We know that public narrative on migration shapes how governments can manage migration and how they can respond to humanitarian needs globally. And I think it's fair to say that despite many efforts to rebalance migration narratives, public opinion on migration has soured, not just in the global north, but in all world regions. It's not true everywhere, it's not true for everyone, but I think it's true in many places. And we know that migrants and refugees can be scapegoated easily during crises, whether that's a health crisis like COVID-19, or a climate crisis, or a disaster, or even if it's just an economic crisis like a recession. And so as we think about responding to this triple threat, it's not just a policy problem and a diplomacy problem, but also a problem about how we engage constituencies and communities and publics to help people understand these challenges without a sense of anxiety and fear. And then lastly, I think there is a critical role for renewed commitment to global governance and global health diplomacy, especially in this moment of significant cuts to foreign aid and assistance and significant retrenchment from multilateral cooperation. So there's been lots of interest in how the US funding cuts will affect development and humanitarian programming. And we've done some recent work tracking the scale of the cuts and their impacts on migration and how we might navigate out of it. But these cuts are global. They're not just from the US. They include Germany, the UK, Switzerland, France, the European Union. And they hit all three fronts of this triple threat. So we know that cuts to global health have meant that programming have meant that medical supplies have run out in some contexts. We know that cuts to migration and refugee programs have meant that food and nutrition rations have run out or been cut in some camps. And we know that cuts to climate action have made early warning systems more unreliable or less accessible. And so when we're talking about global health, we're talking about diplomacy and multilateralism. At MPI, we're starting up a new stream of work to think through global governance in times of crisis. And I think this integrated approach, taking together global health diplomacy, global migration diplomacy, and global climate diplomacy, and really tackling these together is going to be even more important moving forward. But I'll end there because I've gone over. Thank you.
Great. Thank you to all our speakers for your great insights. And now we will move to the Q&A portion of the session. So there's been some questions coming up in the Q&A, and I see that our executive director will kick us off with the questions now.
Thank you very much, Valerie. I'm going to take the profit of being in this panel and ask the first question. So I think a lot of things, super interesting things, have been put together in terms of the work that the three of you have been doing and how health diplomacy comes into place. So I have compounded questions. So we have been hearing about, internal displacement and how that is not only being somehow produced by those changes in climate change, but also how infectious disease are coming into increasing those infectious disease. So one of my questions is more specific on the health side, and I think it will be directed to Dr. Shepard. We see that sometimes Ministry of Foreign Affairs are not quite involved into all this process when infectious disease comes into place across border. But what is do you have any specific example of where the intervention of foreign affairs has helped somehow collaborate between countries in terms of infectious disease. We know this, they don't have borders. Infectious disease, there is no border. And something that you mentioned, and I'm happy that you mentioned Myanmar, because we are seeing in the last month, even though information might not be available, the increased level in certain countries of conflict is the increased level of antimicrobial resistance and the increase of infectious disease, especially in conflict zone in areas such as DRC, Haiti, and Myanmar. So I give you that one, and then what it will be interesting then together, I think for Julia and Lawrence to understand how the internal displacements are being forced. I mean, you have already mentioned, but how those forces in terms of internal displacement have been produced because of climate change, and how does governments react into that sense? I know it's complex, but yeah, I want to see your feedback in that sense. And then I leave it to, I take profit of this, but I leave it to the rest of those questions who are in the Q&A. Thank you.
Thank you, Catherine. Well, I'd just remind everyone that the example that I was using was at the beginning of COVID. And the current administration in the United States was the administration back then and had withdrawn the US from the international community in a similar fashion, although not quite as broad and effective as it's done this time. And so I was contacted as an individual rather than a representative of a US presence by the Global Outbreak and Response Network of the WHO. Simply because I'd been seconded to the World Health Organization by the US CDC earlier in my career. As both Julia and Lawrence have alluded to, we live in a different time now. And I'd have to point out that although these health issues, and in particular infectious diseases, which are infectious, and so they don't respect international borders, require a global response and international cooperation, which has essentially been dismantled in the last 6 months of this administration. So although it didn't work particularly well back during the COVID pandemic, where things like access to vaccines, free movement of personnel and services were limited, at least there was some recognition that this was an important global effort that required international cooperation and a higher view than simply national priorities and sovereign state issues. I think we've gone backwards from there, and we're in less affected territory for international health issues. And so things like viruses that can transmit incredibly efficiently, like I described for COVID, things like tuberculosis, which has always been a global infectious disease threat and continues to be, in some ways, the #1 global infectious disease. HIV, which is a pandemic that I've spent most of my career working in, and services nationally have now all been, to a greater or lesser extent, defunded, will all have massive international impacts that we are less well equipped to deal with. So, I don't want to make everyone miserable, but I don't think I'm telling you anything that you don't know already, that we have real challenges ahead of ourselves. And the diplomats need to stand ready and continue to craft the international approach, because that's really the only way that these issues are sensibly dealt with. They're not national or sovereign issues at all. So I'll stop there.
Great, thank you. And there's a question in the chat as well about interagency collaboration on migration and climate change. And so if you could all speak to how such coordination takes place currently.
I can come in. Thank you for the questions, and maybe I'll start first to reply also to Catherine's question when it comes to internal displacement and how governments actually respond to this. And I think it's a very, very important question. Then thank you for raising it, Catherine, again. But to explain very briefly, when we talk about internal displacement, especially when we discuss those displacement driven by climate-related events, like the case of floods, droughts, intense droughts, cyclones, and many other hazards. This type of movement of displaced people is often sudden and deeply disruptive for these communities and for these people. And really to emphasize that people are not moving because they want to or by choice, but really because they have to. That's out of necessity, as their homes, livelihoods, and safety, of course, is really, really increasingly threatened by these climate impacts. And when it comes to the government's reaction to internal displacement in the context of disaster, they do react in various ways. And this depends very much on the capacity they have in the context. So in many cases, even from IOM sides, we work very, very closely with governments to support them if there's a case of humanitarian needs, but also we work closely with governments to improve their preparedness and resilience, and to really, really support them, for example, in setting up early warning systems, or really trying to monitor the movement of people to try to understand better what this means for policy making looking forward. But governments really try to respond through emergency relief efforts in usual. But there are also, what I want to emphasize, that there are also governments in countries nowadays that we also work closely with, and they are really keen on they recognize internal displacements as a long-term development and climate issues, and not just, they don't look like the internal displacement in the context of climate change just as a humanitarian issues, but really they are working together to integrate this looking forward into their national policies, into their disaster risk reduction plans, or the climate adaptation strategies or climate adaptation plans, thinking about the upcoming COP now. So from my side, we really try to support governments in these endeavors to really try to come up with a more responsive and coordinated way and inclusive way of really protecting the rights of their people. So very briefly to what Catherine was mentioning. And if I can go to the question in the chat, and then I'll give the floor to my other colleagues, related to the interagency collaboration on migration and climate change and the intersection with health in this case. That's something that we very much value at IOM. We really work very closely with different partners, with stakeholders, with governments, but looking only at the other UN agencies like UNHCR, WHO, or others, we really work together through different platforms. For example, think about the UN Network on Migration, or the United Nations Framework Convention on Climate Change, and the Task Force on Displacement, where several UN agencies and other key stakeholders come together. So we really try to develop the joint policy guidance, to share data, to share practices, and to really implement joint coordinated field response when it comes to different intersection of different crises. So I can give more example on this, but just flagging on the fact that this is something that it's extremely important when it comes to the work that we do, also considering to the mandate that each agency has, and it's at the end of the day, it's complementary. So we work together looking and having at the core the main interest of people and the front line of climate change, like either migrants, displaced, women, children, youth, and so on. So I'll get back the floor to my colleagues, but let me just flag another message that I want to convey here. We give the example of the COVID-19 pandemic, both myself and Shefard here, and we flagged examples from Bangladesh and so on, what it meant. But I think one of the the main lessons we've all learned, either practitioners or all of us learned during the COVID-19 pandemic, is that a global crisis requires a global response, and we can only address this by coming all together, by each one of us doing our part, and by coming all together as groups, as communities of policymakers, diplomacy, whatever, to really academia as well, to really try to address the cause. So I think this is one of the main lessons that the COVID-19 pandemic gave to all of us, and that's the case that applies also in the context of climate change, which is a global crisis that affects all regions, not in the equal way, but it affects all of us. And the same for the climate displacement and mobility of people, which again affects all regions, not equally, but it affects all of us. So I'll end here and back to my colleagues here on the panel. Thank you.
Valerie, can I just add on the interagency piece? Because I come from the UN system and I come from sort of the practitioner implementing background, but I'm out of it now. I would say that we have very good examples of interagency collaboration on climate and migration and on sort of migration and development issues broadly, and that the UN agencies over the last, I guess it's now 6-7 years, were very much tasked to find ways to work better and to reform their UN systems. So we have good examples when it comes to joint programming between the UN Migration Agency and the UN Development Program, or out of this thing called the Migration Multi-Partner Trust Fund, which is the sort of pooled migration fund of the UN that tries to get the UN actors and other actors to be working together on programming. And we did an evaluation of a program funded by that in East Africa, which did in many cases find that having these agencies working together across different countries, but in collaboration, allows them to test different approaches to leverage each other's experiences. So I think there's a lot of promise there, and we have good examples. The question is, how do you make sure that this collaboration is about efficiencies and not competition? And I think especially in a new environment where we are doing yet another rapid and in many ways not particularly strategic reform to the UN system, and we are doing that at sort of headquarters level through to country level. And we're looking at the mandates of all the different agencies, and we're looking at how they are working together, and we're looking at how do you actually establish common back rooms and sort of efficiencies in that side, the admin, IT side, how do you pool funding? Interagency collaboration is on the one hand going to be much more important and I think more common, and also the agencies are going to have a lot of trouble balancing the need to get things done with the need for them to, in an environment where there is no money, make sure that they can save their jobs. And I think that balance is going to be really important moving forward. But I do think that the role of interagency collaboration in an environment where we don't have as much capacity and resource is even more important. So I just like to sort of echo that point from earlier.
Thank you both for sharing. And we have another question from a participant, from Adima Padavi, asking about, in regions where some governments are more rigid or slow to acknowledge the health impacts of climate and migration, what strategies have actually worked diplomatically or otherwise to bring them to the table for coordinated action? So whoever feels comfortable starting off.
I can try and come in on this as well from my side, because we, as you know, like IOM, it's an organization that works very much with our member states, and we support our member states in development, in a humanitarian situation, and so on. And yes, of course, when it comes to climate migration, climate mobility, displacements, and so on, not all countries are aligned. Like there's evidence and clear from some countries and maybe less from others. It depends. From IOM side, we try to support always our member states individually, but also as regionally as a group and so on. One of the successful example that I want to give to all of you when it comes to how different countries come together on specific things, looking more towards how we managed to bring all countries together on looking forward and really addressing the same, I think would be the Kampala Declaration on Migration, Environment and Climate Change, which started between a few countries in the Eastern Horn of Africa region, and it expanded at a global, at a continental level, where countries decided and they realized that they need to address this together through a regional framework that come, and we had a lot of interest on countries. So maybe at the beginning was not countries were not aligned, all of them, when it comes to how they should jointly address the impact of climate change on their people, looking internally, but also cross-border in some cases. But lately, like through dialogue, to convening different stakeholders and countries and member states and so on at the table to really emphasize on the fact that this is a continental issue that need to be addressed jointly. We reached to a more comprehensive expansion of the Kampala Declaration, which started, as I mentioned, regionally, but now it's evolved as a continental declaration on migration, environment, and climate change. This is, like, as I mentioned, a clear example of how states come together. Also, IOM has been supporting them. That's basically our role when it comes to addressing this. And then there are many other ways, but indeed, like, it's climate change, as also some of my colleagues here on the panel really emphasize on the fact that climate migration, it's always a mix of several factors that push people to move. When it comes to disaster and displacement of people and sudden onset disaster like floods and cyclones and so on, we know it's something that displaces people immediately. What happens when it comes to the impact that climate change has on agriculture, on the livelihoods of people, that in combinations with social, economic, political reason and so on, lead to people decisions to leave their places of origin behind and move either internally and in some cases in crossing borders. So of course, when we have this kind of the complexity of what climate mobility means, it's really difficult to narrow down also when it comes to specific countries that suffer different type of hazards that impact people mobility and climate change. But there's also the role as a community when it comes to these international frameworks, that space that we have, like the COP and all these conversations that are happening, and we see what it means when we invite states to reach a consensus. It's not easy. It's not usually a easy going way, but I think there's been over the past years really significant advances when it comes to acknowledging the impact that climate change has on mobility, when it comes to acknowledging the role that migrants and displaced population have in addressing this, and also the space that they should be offered. Also, when it comes to the access to health facilities, what we're discussing here today as well, and other things. But yeah, these are just my few reflections here. And yeah, I'll stop here. I don't want to take much of the time to leave it to the other colleagues. Over to you. Thank you.
Very brief comment, just that often what helps when approaching partner governments on this issue, at least when it comes to climate and migration, I have less experience on the health side of this, is we're not asking them to set up, in all cases, new policies, new programs, new staffing mechanisms, new sort of department heads and ministries on climate and migration. If they want to do that, in some cases they have, and that's great. But by and large, when we're talking about the work they're actually doing, their policies and their programs, it's around how do you make climate programs migrant and refugee inclusive, and how do you make migration programming and planning climate resilient, and looking at the mainstreaming and integration of that work rather than setting up new programs and new areas of work entirely. It's an easier sell for governments. It's something that they've done before, they understand how to do, and they see the importance of, whereas in some cases they're just not ready to really understand this as one of the pressing global challenges that requires its own standalone area of focus.
Perhaps as the least diplomatic of the group, I'll add my comments last and briefly. It's difficult for me to ignore the massive shift that has occurred with our domestic politics, which really tended to drive international cooperation, particularly in the health area, of support for UN, WHO, Gavi, various very large international efforts to focus on infectious diseases and climate change and migration. And it seems that this pullback and defunding from the United States is going to be long term. It's been dismantled almost completely. And the re-establishment, I can only imagine, will be an exceptionally long-term project that will still be subject to US politics, which clearly was enabling for its dismantling in the first place. So I wonder, listening to these more regional and global initiatives that don't involve the traditional involvement of the big funders in the room, may change and may even become more collaborative and discursive and evolve diplomatically into a new way of working together and a more valuable, inclusive approach that doesn't just chase after big gobbets of dollars, and may result optimistically in a more equitable and inclusive way of dealing with transnational and global health issues. So I hope that comes to pass. Thank you.
Thank you all so much for joining us today. I think we could talk about this topic for a lot longer, but to be respectful of time, we'll wrap up here. And as we've seen, this is a vital discussion to have on the intersection of climate change, migration, and infectious diseases. We've explored how shifting climates are not only altering ecosystems, but also driving population movements and reshaping global health landscapes. These challenges are deeply interconnected, and it's very clear that our response must be integrated as well. One powerful tool in this collective response is health diplomacy and the use of health initiatives as a bridge for cooperation across borders, sectors, political divides, and within countries. Our speakers' insights and work today has been inspiring in the face of these challenges. So thank you again. And on behalf of the Health Diplomacy Alliance, we want to thank you for your engagement and the speakers for their insights today. Together, through collaboration and diplomacy, we can build a healthier, more resilient, and more just world. Please do not hesitate to contact us. The information is in the chat. And please keep updated about our future events at the Health Diplomacy Alliance. So thank you again for joining.